Outside of the Leber's congenital amaurosis program, we are developing a program for a disease called Dystrophic Epidermolysis Bullosa. And this is a very severe blistering disease. These children, due to a genetic defect, develop blisters all over their body. The blisters pop, and then those wounds never really close. So they develop large open wounds over the entire body. Eventually they start losing their fingers, their limbs, and have a very low quality of life that eventually leads to a limited life expectancy, with a typical life expectancy of about 20 years. So it's a very severe disease, and today there's no treatment option for these patients whatsoever. We're developing a RNAi therapy that is topically applied to the skin, with the goal to restore a normal skin, so to close the wounds and restore normal skin. And we do that by targeting the underlying genetics at the RNA level. So with this therapy that we're developing, the goal is that these patients heal their wounds, restore normal skin, and we are now ready to start a clinical study. So in the next month or so, we will start dosing patients in a clinical study that will take another 6 months to be executed. And in that period, we will treat between 8 and 15 patients with this therapy that we're developing, QR313. And we hope in that period to establish that patients indeed close their wounds, and that the skin in the treatment area remains intact after closure of those wounds. This trial for Dystrophic Epidermolysis Bullosa will be conducted in both Europe and the US. We conduct a study in 10 different hospitals, 5 in the US and about 5 in Europe. And at the same time, we will enroll about 8 to 15 patients in this study. But for that, we believe that we will need the 10 different hospitals that we will work with to find the right patients at the right moment in time. In this study, we will treat patients in a certain wound area for 4 weeks, and then after that 4 weeks, we hope to establish that these patients indeed close their wounds, and that the skin strength improves, and that they restore a normal skin.